A recording in progress. And ladies and gentlemen, Dr. Soleil Arrieta.
Perfect. Thank you so much, Dorian. Hey, y'all. I am Dr. Arrieta. Pronouns are she and her. And thank you guys so much for coming out to my lecture today. We're going to be talking about CBD in a very introductory way. I'm not going to get into the specifics of a lot about dosing and receptors and all the nitty-gritty, because I want to give us an overview of what is CBD, how can it be used, specifically looking right from our Lyme perspective, because a lot of us have not only the Lyme diagnosis, but other co-infections and symptoms that pertain to that. So I'm going to take a step back and say a little bit about myself, because I'm new to Minnesota. I moved here in 2018, so it's a couple years. I am still here. I'm loving the winters. Everyone always asks, coming from Texas, but I love the winters up here. So I have been, let's actually just keep going. I'm just going to introduce myself a little bit and show you guys some pictures. The top left corner kind of is what I think about as my first introduction to medicine. Very lucky after I graduated college to spend time in Calcutta, India. And that is really where I learned, I think, a more holistic view of medicine, a little bit of Ayurvedic medicine, but also the community it takes for a patient to heal. The time I spent in India really was formative to my background and really pushed me to actually come back to the United States and apply to medical school, which I was lucky enough to get in. The bottom left corner is me on my white coat ceremony day. I went to Texas Tech, and that is the guns up. It is not a gang sign, but that is our sports kind of sign, because we're the Red Raiders. During my years in medical school, I continued my interest in international medicine, but also I was forming the idea of integrative and functional medicine, but didn't have those words yet. I was very lucky to meet my mentors in med school and told me about a subspecialty that I could continue learning what I was hoping to bring to my patients, which was the field of integrative and functional medicine. So I stayed there for residency and continued training. After residency, I decided to do something crazy, right? After all that training, I just picked up and moved to New Zealand, which was a fabulous year of my life. I lived in and worked in a small town called Wairoa, New Zealand, in the North Island. And I was very lucky with the people, amazing people I worked with there, but also connecting with my patients. And I learned a lot from them, including a little bit of traditional Maori medicine. And they talked a lot about the plants as medicine. And so in the middle of this slide, you're going to see the green leaves of the kawa, K-A-W-A, that has numerous medicinal benefits, but we used it a lot with skin infections and ulcers, as well as anti-inflammatory properties. And the flower is actually the manuka plant. And so you guys might have heard of manuka honey that has a lot of medicinal benefits as well. On the bottom is Mahia, which is right outside of where I lived and worked. So that spurred me to actually start my fellowship in integrative medicine, learning again about plants and herbs and supplements and lifestyle and everything that I could bring and treat my patients with. I moved to Minnesota in 2018. I was working as an integrative medicine physician at St. Elizabeth's in Wabasha. However, 6 months ago, I was very lucky to be in the right place at the right time. And I met Dr. Karen Verkota, and I took over her practice at Integrative Healthcare of Winona when she was retiring. So I have stepped in and am now the physician at that clinic. kept all the same staff who are fabulous, kept all of the patients that wanted to stay at the clinic, and I've been introducing and welcoming new patients every day. And it's really given me the time to focus on a new field of chronic Lyme, right, and co-infections, as well as mold, patients and SIRS patients and everything, you name it, that sometimes traditional medicine has difficulty pinpointing and treating. So that kind of brings me to today. So thank you so much for having me. And now you know a little bit more about me and my background. I say y'all a lot, but hopefully my Texas twang doesn't come out as I present. So let's take a step back and talk a little bit more about why CBD seems to be everywhere nowadays. And that comes down to the 2018 passing of the Farm Bill. So in 2018, the Farm Bill removed hemp from the Controlled Substance Act. Until then, it was still a Schedule I, technically illegal, had no medicinal properties. They said no one could even think about, research or prescribing it at all. So in 2018, that changed. Now, hemp-derived CBD is suddenly legal. That means farmers can now become hemp farmers, and they're able to have a brand new cash crop. And now, because it's federally legal, banks were able to work with those farmers and give them money to start growing this crop. So we started seeing a massive boom. In 2018, the amount of money that was being spent on CBD products was about 390 million. At that time, because this slide is from 2018, they estimated that there would be such significant growth in the hemp industry that we might hit 2.5 billion by this year, 2022. I don't know what the new figures are today, but that just kind of gives you a little bit idea of how quickly CBD has come onto the market and changed our lives in just a number of years, because it seems like before 2018, no one had really heard about it or talked about it or thought about its use in every day. And now you can find it at the gas station, right? Or your hairdresser, or should I actually spend money and buy the really expensive one that my doctor is selling? We're going to talk about that. We're going to talk about the uses of CBD and which qualities I'm looking for, right, when I recommend a product. But let's dive into a little bit deeper into what this CD product actually is. So when we think of industrial hemp, it is a very large plant that is brothers to the marijuana strain, right? And so back in the 60s, when it was very, I guess, more socially appropriate, right, for everyone to be smoking marijuana, people were very familiar with how that plant looked. It was very a smaller, more stubby. That's more of the marijuana strain. In the same family, right, of cannabis, you have the industrial hemp strain that is very tall, very much thinner, different shaped leaves, and can get up to 20 feet tall. The industrial hemp strain has been used for, I think they found it in an archaeological dig in Japan close to 10,000 years ago. And from that time, we've been using it for rope and shoes and clothing and a food product. And close to about 5,000 years ago, we have found the first evidence of the hemp plant being used medicinally. So 5,000 years ago, Emperor Shen Nun's pharmacopoeia, I believe, I'm butchering that pronunciation, but anyway, for a very long time, we've known about the medicinal qualities and properties of this plant. What makes them different is that the marijuana plant has been cultivated over generations to provide a much higher percentage of THC, which is the psychoactive substance in the plant, right? It's what gives us the high that people will talk about. On the left-hand side of the page, you're going to see 5 to 25% per dry weight of that plant is about THC, has that compound in it. On the right-hand side, to qualify for the 2018 Farm Bill and to consider it a industrial hemp strain, it has to have 0.3% THC or less. So they've really pulled it out, but they still have other components in it. When we are talking about the CBD and the Farm Act becoming legal, it's really just that industrial hemp strain that we're discussing. However, the legality can be somewhat confusing because the 2018 bill passed federally. So federally, we should be able to take these products if they're derived from the hemp strain, et cetera. But some states are not as willing maybe to sign that into law. And so we still have some questionable states. So as of this year, there's a whole variety, right, of different legal statuses per state in here. And you can see that Minnesota has a comprehensive medical cannabis program, but also allows CBD products to people that also do not have a medical cannabis card. Wisconsin is a little bit more strict in their laws. And I only mention that because I know a lot of us come and live possibly on the border. And so we go and visit Minnesota and Wisconsin a lot, or even Iowa and other states. So we have to keep that in the back of our head that if we go out and buy products or purchase products from a third party, we need to know the background of our own state laws so we make sure maybe we're playing within the rules, right? So we're not caught red-handed. Well, it's not really red-handed, but anyway. So what is CBD? CBD stands for cannabidiol, which is a compound found in both the marijuana and industrial hemp plant, right? And so those come together, and both of them together in the family is called cannabis sativa. And the cannabis sativa talks a little bit, right, about rich history and medicine, and even more longer than that, right, used for food source and fiber, et cetera. What's nice about the CBD molecule itself is that it is shown that it's very safe and non-addictive substance, but has a lot of benefits that it can give to us. CBD is only one of over, I think to date, they have 120 different phytocannabinoids that give the plant its various therapeutic properties. These are only some of them, right? I'm not going to list out all 120 phytocannabinoids, but this is some of them. And so when you look at the bottom of the pie chart, you're going to see CBD because it's a very large part of the plant. And we've studied CBD as the phytocannabinoid the most. When we look at CBD, we already see at the top antibacterial, which is fantastic because we're starting to get concerned in 2022 of antibiotic resistance, right? And so if CBD has that antibacterial properties, we're going to say, excellent. We definitely already have some uses for that. But as we go down that list, you also see that it's neuroprotective. It decreases inflammation. It helps with nausea and vomiting. It helps with pain, anxiety, stress, sleep, muscle spasms, seizures, immune disorders, etc. We have been hearing more recently about phytocannabinoids such as CBG and CBN. Those can be found at the top two. The CBG you're going to see on the left-hand side also slows bacterial growth, but has been used a lot in sleep products, and they're looking a little bit more into it in pain. On the top right of the pie chart, you're going to see all of the THC strains. The delta 9 THC is the phytocannabinoid that gives us that high, right? That is the illegal substance that makes marijuana versus industrial hemp. However, the delta-9 THC still has medicinal uses as well. There have been some delta-8 THC products on the market. However, most recently, there has been some concern because of patients' significant side effects. So just know that it's going to take a little bit longer to have more robust studies done so we can understand how these molecules work a little bit better individually, but also together. So together, the phytocannabinoids actually create an entourage effect. The entourage effect is when you have the group of phytocannabinoids working together better, right? That synergistic effect than each individual phytocannabinoid by itself. So we're going to talk a little bit about full spectrum, broad spectrum, and CBD isolates and what that all means. So at the top, we have a full spectrum CBD. So you're having all of the cannabinoids and THC that you saw in the previous slide, right? 120 cannabinoids plus 0.3% of THC or less, because it's coming from the industrial hemp, legal CBD, plus terpenes. Now, terpenes are very interesting. They are volatile aromatic hydrocarbons, which is a fancy way of saying it's what makes an orange smell like an orange. So when you kind of scratch, right, and you smell that, and you go, gosh, instantly I know that's an orange. So you're smelling those terpenes, but what those terpenes are actually doing, not only are they hitting your olfactory nerve, which tells you, oh, that smells like an orange, but they also affect the rest of the body. The terpenes have an inner effect as well. And so we know that the smell of an orange is also uplifting. And so some people use it for energy, depression, etc. The studies of terpenes are more robust when you think of the group, right, and studies with that. The broad spectrum products are everything in the full spectrum except no THC. So you're still getting the rest of the cannabinoid family and the terpenes, but you're not getting that small percent of THC. And a CBD isolate is even fewer because now all you have is CBD and absolutely no THC, and very rarely other terpenes are added in. So it's pretty much CBD and a carrier oil, whether that's extra virgin olive oil or coconut oil, etc. In 2014, there was an Israeli study that was published that showed the entourage effect with either broad spectrum or full spectrum, right? More of all of them together. And they actually used full spectrum for the study versus CBD isolate. And it showed full spectrum worked better per dose than the CBD isolate. And that goes back, right, to the synergistic effect. So 1 + 1 no longer equals 2, it magically equals 3. So you're getting a bigger effect, more bang for your buck with the full spectrum. So they found that pain was reduced at a much higher rate. I think they did pain, inflammation, and I can't remember if they also did anxiety, but we see that, again, if we have our choices now that we're thinking about products on the market, you're probably going to lean more towards full spectrum or broad spectrum because you're going to get more benefits than just CBD isolate alone. The reason that these medications work, and medications like plant medicines, right? So those phytocannabinoids and CBD in general work so well is because we actually have our own CBD system inside our body. We call it the endocannabinoid system, and it's found all throughout the body. And each tissue has those receptors, and they're able to do different things depending on which phytocannabinoid comes in attaches to the receptor, turns on, turns off, etc. The main goal is the same, however, and that's homeostasis. So we're trying to maintain a stable environment. So when I get sick and I develop a fever, right, the body is turning everything on because it's trying to mount a defense. It's trying to burn off the bacteria or virus. It's making me achy. It's causing inflammation, etc. If I didn't have that own endocannabinoid system to turn everything off, then we just keep everything on, and it keeps mounting in snowballing effect. The CBD products work in our own endocannabinoid system to help everything kind of balance out. So as the pain receptors and the pain nerves continue sending out saying, hey, I'm in pain. Hey, this is getting worse. I'm excessively firing, making the pain worse and worse, and I can't go away, and the Tylenol is not working. The CBD products come in and turn everything down. They're also calming the nearby inflammatory tissue that's upset. It's calming the nerve and immune cells that says, hey, we need to put everything on hold. You already did your job, but now let me clean up. This is kind of how it works to both minimize the pain, decrease inflammation, decrease even further injury on as it continues. The endocannabinoid system, we have found two receptors, CB1 and CB2. And what is interesting right now is that while we take cannabidiol, right, CBD, the CBD does not directly fit into CB1 or CB2 receptors, but are thought to have receptors downstream. And we haven't really figured out how and why yet, because the research, unfortunately, is still at its infant stage. And that is because it's been illegal, basically, for this product for so long. We've lost all of those decades that we could have been doing robust studies on this. So we're not quite sure all of the details yet, but we do know in the endocannabinoid system, there are receptors, right? The CB1 and CB2, but there's also other receptors such as the 5-HT and the endocannabinoid and serotonin receptors, and they're all playing this beautiful dance together, right? And playing chess. And all of the phytocannabinoids and terpenes each find their own little thing. So they're not all going after one receptor, but they're working in unison to make sure that all the receptors are working and everything gets used all at once, which is why we think the synergistic effect and the entourage effect works, right? When you don't just have the CBD by itself, but have all of its friends with it. So thinking about the endocannabinoid system and how it modulates pain and inflammation in the brain and appetite, it sounds like CBD in and of itself can have quite a wide range of treatments, right? And what it might be good for. So we're going to talk a little bit about the benefits we know right now of CBD. It's been studied a lot with seizures, right? And so sometimes seizures can be very difficult to control, even with the anticonvulsant medications that people are on. And so we've seen the most number of studies with CBD and seizure patients and epileptic patients, but we also know that it helps to combat mental illness, nausea, vomiting, which is used a lot in patients that are undergoing chemotherapy and have that as an unfortunate side effect. It helps with depression and anxiety, neurodegenerative disorders because it's an antioxidant, and anti-inflammatory, as well as antibacterial and antimicrobial that we've looked at. The antimicrobial is very exciting because as of 1 year ago, there's a new study that was out that showed CBD has an effect on gram-negative bacteria, whereas before, for the last couple of decades, they never thought it did. They thought it would only work for gram-positive. So now we're seeing that it's actually useful in a wider range of antibiotics and can help us, right, with that antibiotic resistance. But also, if we're already taking antibiotics for some of our infections, could the CBD then come in and also lend its hand in fighting off maybe stragglers or persistent bacteria, as well as there's been some research and hope that it also has biofilm effects. So it's really exciting. And then we also know that it's been used for pain management, both in nerve pain and musculoskeletal pain, because we know that those are different, right? So for a musculoskeletal pain where a Tylenol or ibuprofen might help, those tend not to help with nerve pain, right? And that burning, numbness, tingling sensation we get with neuropathy. But CBD and the other phytocannabinoids have shown to actually be of benefit to both nerve and muscular pain. And as an aside, CBD is also safe for family pets. Now, I won't go into that because I'm not a vet, but that's very exciting for someone like me that has dogs and just wants them sometimes to feel a little bit better, but maybe not be on anti-inflammatories, right, all the time. So it's just exciting all around that it can be used for the whole family. This is another look at kind of the breakdowns of the health benefits for the different phytocannabinoids. And so you're going to see a lot in this table that CBD has the majority of them, or at least is covering them. But if we were to take a product with broad spectrum or full spectrum, now you're getting the whole, right, phytocannabinoids, and now you're covering this entire list, which is very exciting as well. The table here has a brief overview of diseases which CBD may have therapeutic benefits. Now, this study was done in 2017, so we're hoping by every passing year and more research studies coming out to publish that we're able to make this list longer, right? That we continue to hope that more diseases can be treated with a plant medicine like CBD. But right now up there, it'll talk about Alzheimer's disease, right? And Parkinson's and Huntington's that we see with those neurodegenerative effects. But it's also been shown that because it's anti-inflammatory and antioxidant, that it's going to help in patients that might have those symptoms, but not be diagnosed with the disease yet. So even if we had a little bit of confusion and brain fog, headaches, seizures, even, the CBD medicine might be beneficial to you. We see down the list too of anxiety and depression, as well as nausea, inflammatory diseases, and even inflammatory bowel disease as well. We also have some cardiovascular benefits as well. In a recent study, they found that after a heart attack, the patients who were given CBD in the hospital showed that the size of the heart attack or infarction on their heart muscle actually was much smaller and decreased in size compared to their other patients that did not get it. And it also helped with cardiac arrhythmias or abnormal beatings or rhythms of the heart. So it has been shown to be promising in quite a number of diseases so far. So because it's been so promising, the next question is, when are we going to see this kind of covered by insurance, right? Right now, there's only one FDA-approved CBD product on the market, and it is currently used for 2 specific seizure disorders that are very difficult to treat with the current medications that we have now. However, because we're getting such promising results from the medical studies to date, the future is bright looking forward. Right now, however, we only have the CBD products on the street, right? Found at your doctor's office or gas station, etc. So it's very important that you understand that the products that are on the market now are not currently FDA approved, and they are not being watched, and there are no guidelines really a lot, except to say that the THC concentration has to be less than 0.3%. So it can be kind of dicey out there. That is why the quality of your CBD product is so important. One study showed that up to 69% of the CBD products sold online in the US were mislabeled. So that's kind of scary. Some people were buying products, let's say you buy a CBD tincture and it says 100 milligrams of CBD in the bottle. They would take those products, and if you were to get it third-party tested, there's a high likelihood that there's less than what they were telling you on the label, and sometimes no CBD product was found at all. So now you've just spent your money on a really nice vial of olive oil, which, you know, olive oil is tasty and everything, but I just spent money thinking it was a CBD product, so I'm rightly kind of upset. The other side to that is if they say they are broad spectrum or a CBD isolate and they promise that there's no THC in the product, if we don't have third-party testing, they could actually have much higher levels of unlabeled THC that we had no idea. We have seen a couple of these luckily it's not as wide, I guess it's not happening as much as I thought it might, but one patient, I can't remember where he's from, but it's on it made news and it was a big story, but he was a driver for Uber or Lyft. He was taking a CBD product because he had lower back pain. The CBD product was working great. He said, I no longer have any pain. I don't have to stop. I'm able to drive longer, etc. But because of his job, because he was a driver, he had to take drug tests. He accidentally tested positive for THC in his system, even though he was taking a CBD isolate product. And the reason is because they were having even trace amounts of that THC in the product, and he had no idea. THC is fat soluble, so there is a chance, like in this man, that the amount accumulates over time. So what they found at 0.018% of THC in his product, which is minuscule, tripped up his test results. So when we are concerned about drug tests, whether we have an employer who requires drug tests or we are driving, right, for our job or taking care of others, we have some instances sometimes in people that we have to require 0 THC, right? Or they are requiring of us. And so we have to submit for a drug test, and we want to make sure absolutely no trace amounts are in my product, because I want to make sure I have no trace amounts detected in a drug test. That is what is so important with understanding the labels of the full spectrum, broad spectrum, and CBD isolates, but also why it's so important to have high quality product that you trust and you know where it comes from. It's had third party tested. It is robust, right? And it's studies and research behind it. Because on the left-hand side, that vial would be a full spectrum. So it has the CBD, all of the phytocannabinoids, 0.3% THC, and all the terpenes, but you could possibly fail a drug test. The middle might be called a full spectrum because it has 0.3% THC or less. But again, that little bit might trip up a drug screen. Whereas if we know, and it's been studied, and we can guarantee there's 0.0% trace amounts of THC in it, you're more likely to pass. If that's the case, and you are a patient that requires to pass drug screens, and you need a product that is 0.0% THC, I would still highly encourage going for a full spectrum product. I'm sorry, I misspoke. Going for a broad spectrum product and not just a CBD isolate, because we know with the entourage effect and the synergistic effect with the other phytocannabinoids that you're going to get more relief and health benefits out of a broad spectrum, which still has the CBD and all the phytocannabinoids, but absolutely no THC. So it's not causing any issues with the drug test. The CBD products are also important to discuss with your physician or healthcare provider. And the reason is because sometimes these products can have interactions with medications that we're taking. CBD products can have a slight blood thinning effect. And so patients on something like right blood thinners, whether that's warfarin or Plavix, etc., might have difficulties with the CBD. And if your physician doesn't know you're taking these products, they won't know sometimes to look for those side effects and those contraindications. We have seen that the CBD might also affect the levels of antibiotics that we're taking. Some antibiotics might metabolized faster, and so therefore doesn't actually get to that dose you think you're taking. So now all of a sudden your medication is not working so well. Some antibiotics, the CBD makes it stay around longer. So now you're doubling your dose, even though you didn't change the number of tablets that you're taking. CBD can also affect sometimes seizure medications, depression, anxiety medications, etc. So while you're still doing your research and finding out which products you like and which company you want to buy from, please tell and have open communication with your physician so they can take that knowledge and review your medications with you, so they make sure that we're not having any adverse reactions, right, or interactions with medications. It's also very important to know where our CBD products are coming from and to get them third-party tested. And what I mean by a third-party test is, let's say I call myself Aunt Soleil's CBD, and I make a full line of CBD products. But then I do my own testing and I say, yep, I made that right, check mark, gold star for me, because I made it with 0% THC, and then I tested it myself, and I told myself, and I gave myself the certificate that I had 0% THC in that product. I feel more comfortable if Aunt Soleil's CBD would send that product to a third party, a laboratory somewhere else that does not have an affiliation, right, with my company, and they tell me, you're right, your CBD product has absolutely 0.0% THC, and here's your certificate saying we analyzed it, and here's all the scientific research that you need. So it makes me feel a little bit better if the company that you're buying from has that third-party testing and can give you things such as the certificate of analysis, because they're not only looking for the concentration, right, of THC and other phytocannabinoids, but toxic levels of pesticides, mycotoxins, heavy metals. And the reason is because industrial hemp has been used for a very long time for phytoremediation. And that's a fancy way of saying it's really good at sucking up and absorbing all the bad things left in the soil and making the soil all better. So it remediates, right, as a plant, phytoremediation, restoring balance, of cleaning out all those toxins from the polluted soil. The problem is that now all those pollutants and toxins are stored within the plant. And now you can have those pesticides and heavy metals and glyphosate and all sorts of things that it's picked up from its environment that it's grown in And if we don't have that third-party testing to confirm that none of the bad stuff is getting into your product, you could inadvertently, unknowingly be taking a product with some of these, heavy metals in them. So heavy metal toxins that can sometimes be found in CBD products are aluminum, lead, mercury, arsenic, cadmium. None of that is on my list of things to do or to collect in my body today. So I'd rather my product just get third-party tested and confirmed that I feel good about what's actually in my product and what is not. When we have found a company and we say, listen, they do third-party testing and they're organic and they're, certified and have everything that I'm looking for, but there's just too many options and ways to take CBD. Where do I even begin? We have the oral route, right? Which capsules with CBD oil in them. We have gummies and candies. We have tinctures, sprays, etc. The capsules and gummy bears and candies take a little bit longer than a tincture that is put underneath the tongue and left there for a minute and then swallowed. The reason is because it has to go through the GI system and you have to digest that, release the medication and, etc. The other thing I'm not so fond of with the gummies and candies is the extra sugar, right? They're putting in tapioca sugar and honey, and some of these candies have 5 to 10 grams of carbs in each one. So that's something to be aware of, right? Especially for our patients with insulin resistance or diabetes, because CBD has been shown to actually be beneficial to help lower blood sugar as well. If I'm diabetic and I'm trying to take CBD to help lower my blood pressure and blood sugar, I probably shouldn't reach for the CBD gummy bear, right? Although it tastes yummy. That's the other thing to think about too, is taste. On the top left, you're going to see a spray on the left-hand side and a tincture in a bottle. And that is a liquid that comes in with a dropper. And like I said, you kind of put it in your mouth and you hold it there, ideally under the tongue, and it gets absorbed into your bloodstream faster because it goes through that mucous membrane, and you're going to have a faster result. So if I'm taking CBD for my chronic pain, I might be dosing with CBD capsules because I know I'm taking a certain dose in the morning and I'm taking a certain dose at night, and they take a little bit longer to work, but they also last much longer. But let's say 3 o'clock rolls around and I tweaked my back and now I need an extra dose. I'm probably going to reach for a tincture that gets in faster so I can have faster relief, but knowing that the time to my next dose is much sooner, right? Because it has a faster onset and a faster end to that dose. Out of all of them, the fastest way to get CBD into our body is actually inhalation. So smoking, vaping, right? Things like that. The problem with vaping and smoking in general is that it is damaging to the lungs. There was concern a couple of years ago with vitamin E acetate in vaping liquids that were causing a lot of people to end up in the hospital with significant lung injuries. So be aware of that if you choose to go the vaping or smoking route. The other option would be topically, right? So they will have salves and lotions, and also even bath bombs, which I find really intriguing. Those products I like to use directly on the source, right? So let's say I have a tennis elbow and it really hurts. Again, I might be taking a CBD capsule that lasts a little bit longer, but I'm also going to take the CBD lotion or gel that I have and put it directly on the area that's inflamed and hurts, and I want direct pain relief at that site. So that's really great for arthritis, right? And swelling and inflammation of the joints. Let's say you injured yourself rock climbing and you have a little bit of skin tears and possibly even an infection starting. Putting on the CBD because of the antibacterial properties, but also the anti-inflammatories, et cetera, would be a great option right there. For my patients with chronic back pain, the bath bombs come into play because they will mix CBD sometimes with Epsom salts, which we know is great, right, for our detox baths. And now you have the warm water with the CBD and Epsom salts, and you're able to soak in the entire body in that CBD at one time. So it can be quite beneficial. The edibles I will mention last because those can be sometimes the hardest to take because they have the longest onset. So sometimes people will take edibles such as a brownie or a cookie, and in Colorado they have drinks and they have water with CBD and THC, you know, all those things. Because again, it's going and you have to digest them going through the system. It can take up to an hour to 90 minutes to start feeling the effect. It's hard sometimes to know to wait that long, especially if you're new to the CBD game. And so let's say you had a CBD candy or brownie or cookie that you got, and it's been 30 minutes and you're like, gosh, this is not doing anything. I don't feel anything. This is lame. I wasted my money. I'm going to have another cookie. And then you wait another 30 minutes. You're like, shoot, I'm going to have a third cookie. And by the time you've had a third cookie, your first one is starting to kick in, and now everything is kind of going off. And you didn't mean to overserve yourself. You just didn't know that the onset could be so long. This is sometimes used to help with sleep, right? Because if you take an edible and you are able to go to sleep, once it starts kicking in, that CBD, because it's taking so long and it lasts so long to work through the system, can help you maintain your deep sleep, your restorative sleep all night long. So that's exciting. Just a little reminder of things that I'm looking for in a brand when I'm looking for CBD products. Some of these are available. It might be difficult to find a company that meet all of these requirements, and all of these requirements might not be the requirements that you have for yourself. But some of them are USDA organic, right? I want to make sure that the industrial hemp that is grown organically. But not only that, I want to take it to the next level and see, is it certified for the Detox Project, which is on the lower left corner. And that is certified pesticide free, including glyphosate, right? That Monsanto. Because the USDA organic label does not necessarily mean absolutely no pesticides. And so that's something to think about as well. I want to make sure that it is a CGMP label, right? Good manufacturing practice. I'm hoping to find one that has third-party testing. And ISO certification sometimes is a certification for labs or company that consistently exceed the highest regulatory requirements. So that's nice to see as well. And if they could show you a certificate of analysis saying this is exactly what's in this product, et cetera, then you've hit a home run. So thank you so much for sitting through that CBD 101 introductory lecture. If you guys are really inclined, I've put some options of further reading, right? There are tons of studies coming out. What is exciting for the Lyme community specifically, I think, is the new option of the antimicrobial benefits of the CBD products, as well as treating the symptoms that a lot of these persistent tick-borne illnesses cause, right? Whether that's sleep or anxiety or chronic pain, there are options out there. So usually if you just go to PubMed and do a quick research, or even Google Scholar, make sure you're under the Scholar tab, you can find the newest and greatest information and studies coming out all the time. So that's something to look forward to. So at this time, I will, I guess, talk to Dorian about questions.
Yeah, so let's see, I should be on again and not seeing me. But that's because, oh, see, boop.
Oh, should I stop
Nope,
sharing?
you're good. No, you're perfect. I just wasn't seeing me, so I just want to make sure everybody else was still seeing me. So if you have any questions, put them into the chat. You already did at the beginning of your presentation. You got greetings, Dr. Arrieta, from Wairo, New Zealand.
Yes.
I'm sure I said it wrong. Megan.
Hi, Megan. Yes, she's my friend from New Zealand that I was talking about. Those fabulous people. Guys, if you haven't been to New Zealand, you have to go. And if you're going back, you tell me because I will go with you.
Yes. And so Megan says hello again. So yay, Megan. Thank you for joining us all the way from New Zealand. That's so exciting. Megan, what time is it there? 2:30 p.m. on Wednesday. So she's like, you know, like almost a, you know, not quite a day ahead. Oh. And another yay and welcome to Minnesota. Great presentation from somebody else. Oh, and Megan says it's 31 degrees Celsius. What does that mean in our temperature, Dr. Arrieta?
So it's summer there. It is quite warm. Yeah, because you know, I'm a lover of cold weather and not necessarily heat. So that's like, oh, but Megan is, I'm sure, enjoying it. And we'll get some of her sunshine soon once the spring comes in.
Well, and she'll have to come here and visit in the winter so she can get a winter suntan.
Right.
Yes. So does anybody have any questions that they have for Dr. Arrieta about anything that was talked about? I did have one question. So because these are plants, and plants are a little more volatile in terms of trying to control what they contain per se. So, you know, with the industrial hemp, it can only have the 0.03%. And so, as you said, you know, you can send stuff off to a third party testing to make sure like there's a 0%. But because plants are sort of more volatile, can there be can those be a little different just because of that? Do you know what I'm saying?
Absolutely. Yes. So that's where it really comes down to trusting your farmers, right? And their cultivating methods. And we didn't even talk about, I guess, CO2 extraction and you know, the way that the CBD is extracted from the plant and how you can kind of control that. But the way that the industrial hemp is grown and the cultivation and kind of the families of industrial hemp before it, et cetera, are all very important to make sure that we are getting that specific percentage and concentration of that dry weight. There have been stories where some, and I don't know who it, basically the government has come in, tested the industrial hemp, found to be too high, and they ruin the entire crop. I don't know if that's, you know, just the media portraying and you know, passing on rumors, but that's always scary, right, to the farmer. So the farmer has a lot of interest in making sure that they are growing specifically what they are supposed to be growing, and making sure that each round is treated specifically to their specifications, but also does not have increased concentrations.
Somebody did say I tried CBD and it didn't work for me, but I'm wondering after your presentation if it was of poor quality. I'll look more carefully for another and try again.
Yes, I will also say that the CBD sometimes does not work immediately when you first start. So that is sometimes throws people off, because depending on our history of the CBD and using that plant medicine, we need to cultivate a higher dose in our own endocannabinoid system. So normally I would say, talk to your provider, your physician, about the dose for which you're wanting to take it, making sure that it's of the highest quality, but also give it a good 30 days. Because if I'm taking it for chronic pain and I take one dose and it doesn't cure my chronic pain, it doesn't mean that it's not a good product and it doesn't work. It just means your body needs time to utilize that plant medicine and all that it has to give you to actually start giving you the health benefits that you're looking for.
Will you carry this product in the office?
Yes, yes. So I am always on the lookout for high quality CBD products in a variety of different methods and ways, etc. So I'm always looking to see which companies I like and brands and stuff like that. I have a company that I've been using personally and in my patients for a very long time. And they were probably one of the first on the markets, coming out, and I think in 2013. So that's very exciting. So they have a really large and rich history, but there's also a lot of new product companies coming out, right? With Colorado kind of being on the forefront, and Washington, et cetera. So I won't ever say I know everything that's out there. So if you guys know, let me know. But yes, I like to carry what I would take and would encourage my patients to take in my own supplement closet in my clinic.
Along with that, also, can it be shipped like our other supplements?
Yes.
Thanks for the presentation. Do you have tips on the best extraction methods we should be looking for?
Yes, absolutely. Great question. So I really prefer the CO2 extraction method. They used to use solvents back in the day. The problem, as we know, right, that the hemp plant takes up a lot of excess, right, chemicals. And so as we use those solvents to try and extract that CBD, some of those solvents would end up in the products. So as an industry, we've seen a huge push for CO2 extractions. And so that tends to be very popular and a lot safer and a lot cleaner right now.
Great talk, Dr. A. Which commonly used antibiotics for Lyme disease need dose adjustment with CBD usage? And then also within that question, is antibiotic dose adjustment needed with topical CBD? Sure. I can only find one report of a drug interaction with.
Yeah, so I think we don't know all of the information today that we will know, and they're currently doing studies on. I know rifampin was one, clarithromycin was one. I'm hoping not doxy, but now I'm losing the details of that study. And so that's why I think it's important, right? So if you tell your Lyme literate physician saying, hey, I want to take this product, will you check my medications? Then they're able to see with the most recent medical studies that we have available, knowing that that information changes, do I need to go up or down on my dosage? What we have seen so far is that the oral and inhalation dosing for the CBD products might cause the biggest contraindications to other medications. Topically, the CBD tends to stay place, right? So if I'm having that tennis elbow and I use that CBD cream topically on my elbow, I will not have issues with that CBD suddenly going and affecting the rifampin that I just took for my Lyme. I can't say that's absolute, but for right now, that's what the studies are showing.
How do we determine dosage?
Sure. And that's a talk with your physician or provider, right? Because the dosing for what you are looking for and what you're trying to achieve is going to be dependent on the other kind of medical conditions you have, your health background, your possibility of taking antibiotics that we need to consider, or other blood thinning medications, but also the concentration of your product. So the dose of a capsule is not necessarily equivalent to a CBD vape pen, right? Or by topical use. So a lot of that information and diagnosing and treating and making a formal treatment plan with your provider, a lot more information has to go into that. So unfortunately, that was a roundabout way of saying it depends, right? Some conditions such as sleep can tolerate a much higher dose of certain products than you might need for pain or anxiety. Luckily, right now, we have not seen the upper limit of that CBD causing an issue, such as like overdosing that you might see with other sleep medications, which is really nice and which makes this product so, I guess, exciting and encouraging to continue doing studies and research into it. In some of the studies, they had up to, I think, 2,000 milligrams per dose, which is unheard of when taking 15 milligrams, right? But that's just exciting. I will say with the 2014 study that was talking about the entourage effect with the full spectrum versus CBD, it showed that the CBD isolate, you would get some benefit, let's say with pain, right, for up to a dose, but if you continued increasing that dose, you did not actually get improved pain tolerance. You actually started getting diminished results. And so there was a bell curve kind of on that, as opposed to the full spectrum, or which they also did in that study, the dose that you're taking continued to be additive, which is really nice. So also something to consider depending on what product you're taking.
Yeah, because I've heard of some people who started taking CBD, it was helpful, but then the effects wore off. So that it's a good possibility that they were taking an isolate instead of a full spectrum or a broad spectrum.
Right, and if you are and it's working, fantastic, but know that if 5 milligrams is working, 10 milligrams might not be worth it, right? Because you might get less pain benefit, and now you're taking 2 gummies instead of 1, and you're almost wasting your money, as opposed to if you bring it down and consider it almost micro dosing, save your money, take a little bit, but still have that great effect. That's going to be where the sweet money spot is.
Are there comparable benefits from eating hemp products directly, or is it too difficult to determine how much of each CBD component we are getting?
Sure. So with edibles, it tends to be very difficult, right? Because a lot of that comes down to what is actually in the product versus what I'm able to digest and absorb. Some of us with, let's say, IBS or IBD, right? And I have leaky gut, and I'm just not even absorbing my normal foods and my nutrients or my supplements. I won't even know if I'm able to absorb or how much I'm able to absorb from that hemp product directly. So it's hard. I think it's not necessarily apples to apples, right? In that comparison.
At the low percentage of THC in full spectrum, will we feel a high?
No, what's really nice is that you don't get that psychoactive component because it's so minuscule. If you were to get a product from a dispensary, let's say you had a medical marijuana card and you went to a dispensary and you said, I would like a full spectrum. Because you had the medical marijuana card, you can legally get a product that's considered full spectrum, but has more concentration of that 0.3% THC. You might get a 2% THC. Not huge, right? When we think of, oh, it's only 2% of the dry weight, but because of that increased dose of THC, that is what gives that psychoactive component, right? Gives us that high feeling, whether it's a head high or a body high. But usually at the 0.3%, people are not having it, that effect, which is really nice because you're still able to go about your day and still drive and still go to work and still be present, but still have those health benefits. Yeah.
Well, that kind of answered my next question. So in terms of what are your feelings about medical marijuana, the prescription medical marijuana for
Sure.
treatment purposes?
Yeah, so I definitely think it has its place, right? So if I, because that to me falls under the category of plant medicine. We've been using it for millennia because we know it has great benefits. Then we kind of have to take a step back and say, well, we know it's great. We know it has this rich history, but what do the products today look like compared to back then? Some people, when they're looking at medicinal marijuana products, have to be very cognizant of those ratios of THC to CBD to other phytocannabinoids, terpenes, etc. Because the marijuana strain has much higher percentage of THC naturally, right? The concern is with adolescents and a very high percentage of THC, because we have seen some concerning studies, and they still need to repeat them, and we're still doing further research into this, that adolescents that tended to consume higher THC marijuana strains could have significant mental health issues and could sometimes possibly exacerbate unknown or undiagnosed underlying schizophrenia. And so that's very scary, right, to think about when we think about that age group in general. And we think right now it's because the brain and neuroplasticity, right, it's still growing, the adolescents are still young. We have not seen that same issue in CBD products, right? When we remove that THC, they're still getting the health benefits. Let's say they have epilepsy, but we're not having that concern with that higher CBD, that higher THC product. I only mention that because if we have a medical marijuana card, you now have access to all of these other products with much higher THC concentrations than I have access to on the market, right? The medical marijuana has also shown to be beneficial with a lot of the symptoms that we see in our Lyme patients as well. And a lot of those we've already talked about, right? With the CBD, et cetera. The THC, however, has shown to be slightly more beneficial with insomnia and sleep sometimes, which would help me to feel better about taking a full spectrum with even that 0.3%. It actually helps because of the synergistic and entourage effect. If we don't have a medical marijuana card, to even have that small amount help with the sleep, right? And issues with that. So if we have a medical marijuana card and you already have a physician that prescribes that, I would absolutely say keep using it, but consider possibly different products that might be of benefit to you that you might not have considered if you've always been taking a high THC strain of something, right? Because you could still get that THC, but pull back a little and increase your CBD percentage and maybe even unlock a little bit more of those health benefits that we talked about.
Super. Does anybody else have any questions for Dr. Arrieta today? Going to give you another little bit of time to throw in a question there on the chat. Thank you so much, Dr. Arrieta, from somebody on here.
Well, thank you guys for coming out and listening to me, and hopefully I made sense, but you can reach
you were
out.
great. Thank you so much. It was really informational. And I think, and because I think many of our patients are, they know about CBD, but don't necessarily know the ins and outs of what they should be looking for and all that it can do. So thank you so much for doing that. And we really appreciate you being here. And we're so excited that you're part of our Minnesota Lyme community. So we do have coming up, Dr. Vercoda, are you still on? Let's see here. Is she still there? There she is.
Yes, I'm here.
Oh, good. Can you, I wonder if I can take so we can see you. Boop, boop, boop. Well, it looks like you should be on Soleil. If I make it so I can see you. Where are you? There she is. Hello. So we have something exciting coming up, and this is really all of Dr. Vercoda's brainchild. So I'm just going to let her talk to all of you about this. So, and then if there's anything I need to clarify, I will, but I'm just going to let Dr. Vercoda talk about it. Dr. Vercoda, you have the floor.
Thank you. I have been thinking about a way to give back to the Lyme community, and I came up with the idea of free Fridays, when practitioners can join as many as they want to, and they could do a chat with each other and see what's new in their practices. And then that would give people with Lyme an ability to ask questions, that we wouldn't be able to say you should take azithromycin 375 4 times a day, but we would say in general that is something that group of antibiotics is helpful for, or you should better check about interactions, or to know about herbs. Dr. Bernarda Zenker has volunteered to be here with me. It's the last Friday in January. I think it's the 28th. All the Fridays in February and all the Fridays in March, and we'll just see how it goes. All of the nurse practitioners from Newbridge Clinic have expressed interest in joining us. They haven't signed up for a certain day yet, but they're looking at their calendars. And I said they could just pop in and pop out too. That it would be a fluid experience. That we're going to start at 3. And maybe it would just go from 3 to 4 if there wasn't much going on. But I'm willing to go from 3 to 5 and talk about what's new, what's exciting, what's on the horizon in Lyme disease.
So we will set this up through the Minnesota Lyme Association. So we'll be moderating for this, and we will send out an e-blast to everybody so that they've got this will all be on Zoom. So you'll be able to access this through Zoom, and we're still kind of figuring it out, but we will have that information, of course, on our website. We will be sending out e-blasts like you normally get from us. If you are not getting e-blasts from us, please go to our homepage at mnlyme.org. At the very bottom of the page, there's just a little spot that says subscribe. Just put your email in, and then you will get email blasts from us. It's just that simple. Also, we have 2 Facebook pages. One is a private group, so you can ask more questions of other people in the group, and then one is a business page. On both of those pages, we'll be publicizing this for you guys, and probably what we'll do, because the additional practitioners will be fluid, so we will probably be announcing who's going to be with Dr. Vercoda that week on the Facebook pages. So you'll be able to check there to find out who's going to be joining. So we're so excited and grateful to Dr. Vercoda for coming up with free Fridays, because I'm sure people have lots of questions. And so we're going to, you know, we're going to see how this all goes. It's going to be great. We're very thankful to Dr. Rakota and all the practitioners who will be joining her. So that's what's next. And we do have a regular support meeting next Tuesday, which will be the 18th, I believe, looking at my calendar. So my phone's closed down, so I can't see what the date is, but next Tuesday, that should be the 18th. We will have a support meeting at 6:30. What we're gonna do going forward from there, we're not quite not sure, just because we're gonna be doing these free Fridays too. So we will see what else the rest of the winter will bring us, but we're so excited that to offer this service to our patients so that they can come and ask questions. So I think that's all I have to tell you right now outside of Dr. Arrieta. Thank you so much again for the wonderful presentation. We did record this, so we will be putting it up on our website. It does usually take a few days because I don't do it. Somebody else, I send it off to somebody else and we have to wait to get it back. But so it will hopefully be up there if you want to look at all the information again, because I know it's a lot to stick in our brains. But thank you again, everybody, for attending tonight. We appreciate it. I hope that everybody finds something to bring them joy this week and to make them laugh, and that the sun comes out and everybody has a great day tomorrow. So thank you again. And I hope we see you, some of you, next week, and that you start to join us at the end of the month for Free Fridays. So thanks, everybody.
Thanks for having me.
Thank you.